Hi, I'm Dr. Jeff Forsley with Lamont Natural Healthcare. I'm a chiropractic physician and a holistic practitioner. I'm board certified in integrative medicine. I've been in practice for 28 years and I love helping people with chronic health conditions. As a holistic physician, I evaluate, manage, and balance the different systems of the body. First, we come up with a diagnosis, then we're going to find the underlying cause of your problem, and then we're going to manage it with natural therapies that work with your body. Medications can help symptoms, but they do not get to the cause of the problem, and they do have side effects. 50% of Americans have a chronic disease. If you are suffering with a chronic health condition and it is having a major impact on your life and your current treatment or your previous treatment hasn't helped, it's time to try our unique natural approach to chronic health conditions. At Lamont Natural Healthcare, we offer neurometabolic therapy. Your nervous system controls 100% of your body's functions. Click on the section labeled Neurologic Therapy and view Dr. Imber's discussion regarding our neurologic therapy. So first what we're going to do is a comprehensive history and really sit down and listen to you and take the time for you to explain your problem to us. Then we're going to run some lab tests, and some of these tests are going to be more comprehensive than you've had done in the past. And we need to run these tests to find the underlying cause of your problem. So let's talk about our metabolic therapy program. We're going to start with the gastrointestinal system. Hippocrates, the father of medicine, said, "Look to the gut for the cause of most human illnesses." Your gastrointestinal system is a tube. It starts in your mouth, it goes down your esophagus, your stomach, your small intestine, your large intestine, and your rectum. And this tube is a barrier. And when you break this barrier down in condition like leaky gut syndrome or intestinal permeability, you leak toxins into the bloodstream, and then you have an immune reaction. So we're going to run some tests on your gut to find out the cause of your problem. Some of these things that these tests can uncover are chronic infections like parasites, bacterial infections, yeast infections, and these tests can also tell if you have enough of the good bacteria in the gut or your probiotics. Your gut makes up 80% of your immune system. So if your gut is out of balance, you can end up with serious autoimmune conditions. An autoimmune condition is just the name of the tissue that your immune system is attacking. Your immune system is supposed to be protecting you. When it's been out of balance for a long period of time and it weakens, it's going to turn on you and attack your own tissue. This is called an autoimmune disorder. So we don't just want to treat symptoms, we want to find out the cause, manage the underlying cause, and help you not only help symptoms, but balance your immune system. Lastly, your nervous system controls your digestive system. Let's talk about your immune system now. Many chronic health conditions are due to a weakening in the immune system. We have to evaluate the gut since it again makes up 80% of your immune system. Your front line of defense of your immune system is called Th1 and Th2. Th1 are your white blood cells, Th2 is your antibody response. And when you have a chronic health condition, especially autoimmune conditions, there's an imbalance in Th1 and Th2. One side is more dominant, and we need to find out what side is dominant in order to treat you properly. When we look at the different substances, vitamins, minerals that can actually push Th1 or Th2 or enhance that, for example, if you are Th1 dominant, vitamin C will enhance or push Th1. So if you're Th1 dominant and you take vitamin C, it could actually make you worse. So there's a whole scientific approach that we use to find out if you're Th1 or Th2 dominant. Next, Th3 regulates Th1 and Th2. And there's many nutrients that regulate Th3, such as vitamin D. And lastly, Th17 regulates Th1, 2, and 3. And there is a natural approach that we have to balancing this entire immune system. If your immune system has weakened to the point where Th17 has to kick into gear, then you now have tissue destruction and an autoimmune condition. And your immune system is controlled by your nervous system. Next, we're going to talk about your endocrine or hormone system. Hormones are some of the most powerful substances in our body. Think about the thyroid hormone. That's the master metabolism hormone. When that is low, everything slows down. You can have fatigue, weight gain, brain fog, constipation, you're cold all the time, your metabolism is slowed, and think of adrenaline. If you almost get in a car accident, your heart rate is way up, your heart's beating very fast, your whole system is on edge. That's how powerful these hormones are. Part of your brain called the hypothalamus controls your pituitary gland, which is in the brain. The pituitary gland then controls all the glands in the body that release hormones. So you've got the pancreas releases insulin to balance your blood sugar. Your adrenals release cortisol, that's your major stress hormone. Your thyroid releases thyroid hormone for metabolism, and your gonads are going to release estrogen and testosterone. So we really need to evaluate this system. The other thing about these glands are they actually communicate with each other. So we need to take a holistic approach and look at all these glands and how they're interacting with each other. Now we're going to talk about diet and toxins. We are bombarded with toxins throughout our lifetime. Literally thousands of toxins that poison our bodies, in our food, in water, in the air, in our personal care products. Heavy metals like aluminum and mercury, these are detrimental, they're toxic to our system. Aluminum and mercury, which are in amalgam fillings in the teeth, they're in vaccinations as a preservative, thimerosal. These heavy metals toxify our body, but they also kill nerve cells. A poor diet is going to lead to ill health. You are what you eat. Trans fats, or the poor fats, are going to block nutrients going into and out of the cells of the body. So you can't get nutrients into the cells and you can't get waste products out of the cells. When you eat too much sugar, it causes inflammation, which is the underlying imbalance in most chronic health conditions, and it's going to cause dysglycemia. This is abnormal blood sugar conditions like diabetes type 1 and 2, hypoglycemia, metabolic syndrome, and insulin resistance. The number one stressor on our bodies is blood sugar abnormalities. These have to be balanced. We look at processed foods, all these genetically modified foods, our bodies don't even recognize these. For example, gluten sensitivity has almost quadrupled in the last 15 years, which was when we started genetically modifying our food. And lastly, high calorie, empty nutrient type of foods just all leads to obesity and ill health. So let's summarize our metabolic program. We need to manage and evaluate the gastrointestinal system, the immune system, the endocrine system, diet and toxins, and also remember the nervous system controls all of these other systems in the body. Holistic therapy is find the proper diagnosis, find and manage the underlying cause of your condition with natural therapies that work with your body. If you do not find the cause of your condition, you may never get better. Our unique comprehensive approach to chronic health conditions is a neurometabolic approach. Now, we are offering you a free consultation. We will take the time to sit down and listen to you. This will also allow us to explain our holistic program to you in detail and allow you to ask any questions you may have. Call us at 630-257-0550, and I look forward to meeting you. Thank you.